Are you suffering from any pain on the bottom of your foot? Particularly when you wake up in the morning, you step off the bed, you notice there's a real sharp pain in the bottom of the foot or even the heel. You're most likely suffering from plantar fasciitis. But good news, there's a way you can treat it, and I'll show you how you can start doing things now so you can fix your plantar fasciitis at home. So first thing we want to do is start understanding what the plantar fascia is. And what it is a thin layer of fascial tissue, which goes from the medial aspect of the foot, lateral aspect of the foot, all the way to the heel in kind of a triangle type of fashion. And when we start to get tightness in certain muscles, particularly in the back of the calf, your gastrocnemius, your soleus with a calf complex, that can start pulling on this heel, as well as you can get some internal foot pain if your foot's pronating. As you can see, my foot's a little bit flat. I have foot pronation, so I'll also show you how you can do stuff to fix that without getting any type of orthotics in order to mitigate the chances of developing plantar fasciitis in the future. So first thing we want to do is we want to release the plantar fascia and the tissue that is tight and pulling on that plantar fascia. So what I like to use is a tool called a gua sha, and take a little bit of lotion or anything that'll help the tool glide along the foot. And you're just going to go back and forth and just try to work into that tissue. This is going to promote blood flow. It's also going to help with the orientation of the fascia as it heals and those new collagen fibers are laid down. So you're going to do this for a few minutes. It's really tender if you are symptomatic, so be careful and start lightly and then increase the intensity as you go. So we want to work that fascia tissue, but we also want to work that Achilles tendon, because generally our calf complex is very tight, as well as the posterior tibialis, and that could be causing the development of the plantar fasciitis. So make sure you just get in there really good. And that's pretty tender on me, just from running, from training, things like that. And you're going to do this for a good amount of time, but what you're looking for is little red dots, and those are called petechia. And when you see that petechia, that's a good sign that you're done. And those are just little broken micro blood vessels. So, and it heals up just fine. You may get some bruising from this type of treatment. Totally normal, it'll heal. So that takes care of a lot of the superficial tissue, which will cover that Achilles tendon as well as that plantar fascia. But you also want to get deeper, in particular working on a muscle called the posterior tibialis. So for this muscle, it inserts into the navicular bone. And as you can see, because of my pronation of this left foot, I've actually grown this bone. It's actually hypertrophied because of that stress placed on it from my posterior tibialis tendon. So this often gets tight on me. If you're a runner, especially if you have any type of pronation, you may feel these type of symptoms right behind that medial malleolus of the ankle. And that's where we're going to start when we start working on this guy. So it's nice because I have that little bump, so I kind of know where I'm working to. You want to go right behind that medial malleoli. It's going to be tender because the tibial nerve is there, so be careful. And focus on the tendon versus the nerve. And the tendon's going to kind of pop back out of you. It's kind of like a rubbery feel. So you're going to want to work the tendon a little bit, and you can even grab the gua sha. And since that's a little more superficial, you can work in it a little bit like that. That's helpful. But then we really want to get the muscle belly, and the muscle belly is going to be located much higher throughout here and insert on that superior aspect of the tibia, the proximal aspect of tibia. So I'm just really just digging in. Ooh, and it's pretty tender there. That's a pretty good muscle knot. And for this one, you want to do it for feel. If you haven't done this before, it may take some time to develop what that feel is, but you're waiting for that muscle to just loosen up, go from kind of a tender steak to a raw steak, if you will. And then after that's all worked out, we're going to then do some kinesio. All right, after you got the soft tissue released in the plantar fascia as well as the posterior aspect of the lower leg, do a little bit of kinesio taping. So what we're going to do is a technique called the heel lock. And what this is designed to do is put the heel in a dorsal flex position, so we're not tightening that posterior musculature of the back of the leg, which is going to pull on that fascia. It's going to keep this in a more neutral position, which is going to help the tissue heal. So it's very important you hold your foot in this position while we're doing the taping. Now again, we're going to start right behind and underneath that medial malleoli, and then put a little bit of stretch in the tape. You're going to wrap around the ankle. Try to avoid any wrinkling of the tape, and you're going to work your way up just about there. Really, you just want to go about right above the ankle. And then I'll show you the other one. So again, keep my foot dorsal flexed. This time I'm going to start on the lateral malleolus, same kind of position. And then again, just work it around that heel, keeping it dorsal flexed, avoiding wrinkles. And put that. Good, not too bad. Okay. It's easier to have somebody else do this for you, but if you don't have that option, you can always do it yourself, okay? And that's just gonna hold my foot in a better position throughout the day. Bonus tip, in case you're having a lot of Achilles pain, you can distract some of that pain by just taking a piece of tape. This is more for that Achilles tendonitis. Take one last piece of tape there, and then yeah, for that Achilles pain, you can just kind of add the add a little bit of pressure, and that'll help disperse that pressure and let it dissipate around the rest of the foot. Okay, and that's that. All right, so now we have the foot taped in a better position. We've released the musculature. I'm going to quickly show you another way to help release. It's a great way to do either like before bed or early in the morning is just take a tennis ball. You can kind of just add that pressure, and that'll help release that plantar fascia as well. And then as it starts getting better, you can add some more pressure and really help loosen that up. Okay, but what we really need to do to prevent this from developing again is to stretch out the posterior calf complex and that tibialis posterior as well. So the way we're going to do this, it's very simple. You're just going to come up to a wall, and I'll show you a couple ways to do it. We want to stretch the muscles that cross the knee and the ankle, as well as the muscles that only cross the ankle. So to do this, I'll show you the gastrocnemius first. Now this muscle passes both the knee and the ankle, so keep that knee straight to target this. And all you're going to do is just put that stretch in there and get closer to the wall for more depth. Hold this from about anywhere from 30 seconds to up to 2 minutes. And then for the soleus, what you'll do is you'll bend the knee and you'll do the same kind of thing. Now this muscle only crosses the ankle joint, so you don't need to have that knee straight to target this muscle. This also gets that posterior tibialis pretty good. If you want to get a little bit more on that, if it's tender, you can kind of lean your ankle into that pronated, only for the stretch though. Okay, so an often neglected area of treatment when treating plantar fasciitis is strengthening the intrinsic musculature of the foot. Now, I'll show you how we do that right now. Okay, now when it comes to strengthening the intrinsic musculature of the foot, what we really want to work on is building motor control over the muscles of the foot and more proprioception within the foot joints. So a good exercise for beginners to start this would be toe crunches. And all you're going to do for this is get your foot on a towel and practice scrunching that toe and bringing it closer to the rest of the foot. Okay, and then you can straighten it out and repeat kind of as needed. All right, when you start to get a little bit better control of that foot, we then want to increase the motor control of the toes individually. Now to do this, first let's just push that big toe into the ground and lift up on the rest of the toes, and then do the opposite. Good, my foot down, switch. And as you can see, my foot is actually starting to shorten when I push down, and that's helping create that longitudinal arch in my foot, which will mitigate any chance of developing plantar fasciitis in the future. Okay, so give that exercise a try. So if you're suffering from any type of foot pain, I hope that this information has helped you. If you like this, please like our page and subscribe for more information, health and wellness. Thank you.